Okay, so my name is Taylor Vota, and this is my final project, and I decided to do manual development on parenting children with ADHD. So this is essentially a manual being a guide to dealing with hyperactive children. So obviously the first part of parenting a child with ADHD is understanding the disorder. Long and short of it, ADHD, or attention deficit hyperactivity disorder, is a developmental disorder that affects one's self control. The main issues that surround the disorder, but aren't limited to, impulse control, hyperactivity, and attention span. The condition affects the frontal lobes of the brain, where most of the decision making, attention span, concentration occurs. Um, so, in those with ADHD, there's excessive brain inactivity, so it makes normal day to day activities extremely difficult. How is this inactivity caused? We know that the brain sends messages by releasing chemicals called neurotransmitters between brain cells. Um, for the brain cells to efficiently communicate, the neurotransmitter must avoid a reuptake transport system. Um, the system this system is basically something that tries to absorb the released neurotransmitter and bring it back into the original cell. Um, so if it's able to, once it makes it way past the reuptake system and across the gap between the cells called the synapse, it will activate the receptors on the nearby brain cell. Um, if it's sufficiently activated, then it'll then release neurotransmitters to another nearby cell, continuing the communication process. Um, I've included a figure on the next page that kind of shows this in like a diagram form. Um, in unaffected people, this area of the brain is sufficiently activated and people are able to concentrate on one task and ignore distractions. In the ADHD person or child, this region is insufficiently activated. So it's really hard to concentrate on one task, focus on what you're doing, think before acting, and understand what they're reading or doing at the time. Um, Dopamine is the neurotransmitter that's associated with attention, thinking, and controlling our moods and movements. Um, so in the picture that I included, uh, and you'll see that in a second, is it dopamine receptors in the brain are shown, giving you an idea about how the brain communicates. ADHD is not caused by lack of dopamine in the brain, but rather is associated with how the brain releases the dopamine. In brains that are affected by ADHD, it's been found that the dopamine reuptake system absorbs more than 70% more of the released dopamine in those without ADHD. So, meaning the brain's not communicating properly and not basically making those messages send like they're supposed to. So this is just a quick picture of vaguely what it is. So this is a prefrontal cortex, and this is an example of a neuron that would produce dopamine, which is the neurotransmitter associated, like I said before. And so there's synapses that send, they start from one side of the cell and then go across the gap, which is the synapse, to the other receptor. In those with ADHD, the reuptake system is absorbing more of the dopamine than in those without it. So the dopamine's not getting passed on to the receptors. So that would mean that there's inactivity, causing things like concentrating, staying on task, stuff like that really difficult. So causality of ADHD. ADHD affects about 3 to 10% of the population, but when one parent has a disorder, the likelihood that your child will have the condition dramatically increases to about 57%. So yes, ADHD is genetically inherited, but you cannot give your child ADHD. There's rumors circulating and controversy around whether or not you can give your child ADHD, but it is not caused by vaccines, poor parenting, or too much sugar, or any of the other things. It's genetically passed on or is just plain and simple in your genes. The traits that are inherited are usually the lack of dopamine receptors and transmitters. So, what to expect in a child with ADHD? ADHD is characterized by four main issues: hyperactivity, impulse control, inattention, and excitability. Um, Hyperactivity, as you know, refers to excessive energy, fidgeting, inability to sit still, and lack of tiredness. I know a lot of children will be hyperactive or have a lot of energy, but the hyperactive children will do things like move more than other children, and his movements might be purposeless or inappropriate, and it's just because they have little to no control over their movements. Hyperactive children can't like focus on current tasks and usually don't finish them. They'll run when they're supposed to be walking and can't sit in their seats, and will get up out of their seat during class, stuff like that. Um, Also, another trait that's associated is impulsiveness or a lack of self control. So, blurting things out, interrupting, making dangerous decisions, and just overall not thinking before doing. So, in layman's terms, leap before looking and doesn't really think about it at all before they do so. Um, Things like not thinking about the fact that they don't know how to swim before jumping in the deep end of the pool, um, or taking things apart without having any idea how to put it back together. Um, since your child isn't thinking before doing, they're more likely to get themselves hurt, like darting into traffic without thinking, blurting out secrets, or jumping off things without thinking about the consequences. Also, this impulsiveness associated with ADHD makes your child more likely to lie, ditch school, run away, get into trouble, and steal things, and not because they are bad kids and think that it's okay. They just legitimately do not think about it before they do it. Um, Inattention is obviously a big part of ADHD. Um, so obviously, the attention span is just really short and they're unable to stay on task. You may have noticed that your child can sit in front of the TV for hours or play video games for hours on end, but as soon as something requires any sort of effort or something that they have to do, all the motivation and attention span is like right out the window. Um, they may sit down to do their homework and notice that the clock across the room is ticking, and now all of their attention is now on the clock. So yeah, you can remove the clock, and this would solve the issue temporarily and get them back on task, but they're just going to find another distraction. So small projects like writing a 3-sentence thank you letter to grandma and grandpa could take multiple start attempts and days for something that could be accomplished in really a matter of minutes, and it's just because they cannot focus on the task at hand and get it done. Also, the inattention will contribute to things like forgetting, or losing things, like leaving their bike at the park because they got off to go get something and just walking away from it, or setting their jacket down on the playground and just completely forgetting that they did that. So lastly, the one of the main components of the disorder is excitability. This could get confused with getting excited, but it's also um, would refer to the fact that your child gets easily upset. This usually is what makes dealing with ADHD really difficult because they can be moody or have zero tolerance for frustration and will act on this frustration without thinking. For example, they'll not understand a word while reading and just take wild guesses without sounding the word out. Um, After they realize they aren't getting anywhere, they get frustrated and discouraged and give up entirely. Uh, or something doesn't work, they get really worked up about it and throw a fit and either break it, throw it across the room, something like that. This excitability will contribute greatly to your child's moods, where a simple comment about the weather or good morning could turn into whether or not it's really good morning or what the weather is actually like. Um, Dealing with these mood swings that are unpredictable and you have no idea how long they're going to last can be particularly hard on the child and you, because your child is upset about something and you can't get them to shake off their irritability and you can't do anything, and sometimes will create resentment and hostility and just a tense environment at home. Also, children with ADHD and adults with ADHD sometimes will have difficulty maintaining friendships because his or her behavior might be interpreted as immature. So, ADHD, there is no cure, but there is ways to manage it. Um, there's a lot of controversy, obviously, around using medication on children, but there are options as well as ways to manage the disorder without medication. So, there's there's a couple different kinds of medications. There's stimulants, non-stimulants, and sometimes antidepressants will be used. So stimulants are the most widely known use or medications used for ADHD. Um, so there's different kinds within this. Some last about 4 hours and require multiple doses in one day, while others are taken just once and will last up to 12 hours. Stimulant medications help with brain inactivity. Um, so basically, things like, so for example, Ritalin um, works by attempting to boost the communication rate between dopamine receptors in the brain. So it attaches to the reuptake transporter and prevents it from absorbing the released dopamine so that it can be activated in the nearby dopamine receptors. So this will improve intention, concentration, self-control. Considered as the long-acting version of Ritalin. It's taken once daily. Ritalin is taken usually twice a day, depending on what your child is prescribed. Another commonly used stimulant medication is Adderall. Adderall is twice as strong as Ritalin. The reason why it's stronger is because um, it has two kinds of medicine in it. It does the same thing as Ritalin, as well as it releases dopamine from the cells. So this increases how much dopamine is released and also how much dopamine is being transported across the cells. So this would help with things like attention and focus and stuff like that. Side effects will include loss of appetite, nervousness, insomnia, anxiety, nausea, and stuff like that. Non-stimulants are also used for the treatment of ADHD. Sometimes they're used alone and alongside stimulants. Antidepressants are commonly used alongside ADHD stimulant medications. Sometimes they're not used, or they're used alone. There's a lot of options and route you can take with using antidepressants for the treatment of ADHD, but carry more side effects and risks, like risk of suicide, especially when used in children. So if that's something that's recommended, talking to your child's doctor about this would be the most beneficial for you. So obviously managing ADHD alongside or without medication are also options too. The most proven effective theory management is behavioral therapy along with medication. So things like creating a routine. So behavioral therapy uh, would refer to things like reorganizing your child's environment at home and giving them clear instructions. So things like creating a routine so they do the same thing from the minute they get up to the minute they go to bed every single day and know exactly when it needs to get done. Having things very organized, having common daily items like backpacks and shoes in very specific places with labels too will help your child get things put away and hopefully decrease how often things are lost. Give choices but limit them. Give two choices about what to wear and let them make the decision. And it also doesn't overwhelm them. Avoid distractions, obviously. Turning off the TV, having homework get done in another room away from other children. Changing the way you talk to your child. The attention span of these children is obviously short. So giving long worded explanations or instructions is a waste of everyone's time. Try giving your child commands that are and directions that are clear and concise to help your child better remember their responsibilities. Use goals and rewards. Create a chart with your child's responsibilities and tasks and positive behaviors that'll give your child like a positive reinforcement about what needs to get done and what they've accomplished. Use appropriate discipline. Avoid spanking and yelling at your child. Have a designated timeout chair. Take away privileges when inappropriate behavior is displayed. Or if your child is younger, ignoring them while they're acting out or distracting them, having them walk away from the problem can be helpful also. Help your child find a hobby. This will help, or a talent, something that they're good at, whether it's sports, music, art, will help them boost self-esteem basically and help them with social skills also. And lastly, I think the most important is having patience and not losing your cool when dealing with your child. Even though your ADHD child can be extremely difficult and act out, having patience is definitely the best way to get through it. Overall, I think that parenting children with ADHD can be incredibly difficult and require different parenting strategies, but setting up an environment that is structured, consistent, and organized will be most likely the most beneficial for the entire family. Consider talking to your teachers, your child's teacher about setting up a behavioral contract so there's some consistency between home and school, um, so that they're able to have this consistency in all areas of life. Um, Overall, I think that knowing that your child needs you, even though they can be extremely frustrating and difficult times, is something to remember. Um, and that's basically it. And then these are just the references that I used in making my manual. Thank you.